Here we are going to discuss about osteoporosis, which is a very important topic of orthopediatics of final year students for university exam as well as for a next exam. The osteoporosis it is a metabolic disease of a bone which is characterized by a diffuse reduction in the bone density due to decrease in the bone mass, that is called a quantitative defect, in which a density of a bone mass is a decrease. It occurs when the rate of bone resorption exceeds the rate of bone formation. Okay. Now we are going to discuss the causes of osteoporosis. That is, the first is a senility, postmenopausal protein deficiency, endocrinal disorders, and drug induced. In senility, you can see it's a age related disorder, age related condition in which the male is most commonly affected. Postmenopausal, in which a female is affected due to a estrogen hormone is present in a till the menopause. After menopause, the estrogen deficiencies occur, so estrogen is protective against the osteoporosis. Protein deficiency, inadequate intake in old age or illness, malnutrition, malabsorption, excess protein loss, third degree 1 or chronic renal failure, etc. Endocrinal cussing diseases, cussing syndrome, hyperthyroid state, and the drug-induced long-term steroid therapy and phenobarbital therapy. Now we are going to discuss the clinical feature of osteoporosis. It is an asymptomatic disease unless complication predominantly feature occur. It is the flowchart where I can explain how the patient of osteoporosis come to the physician. Loss of bone mass, that you can it is the earliest sign of osteoporosis, which lead to a loss of strength of a bone, so that even a tribal trauma or a prick in the bone which cause the fracture of the bone. The fracture in which the vertebral fracture, which is a very common dorso-lumbar spine. So the fracture will get the pain to the patient, and the reason why the patient consult to the physician. The other fracture are colles and neck of the femur. Colles fracture are the wrist fracture, or maybe we can say the distal fractures. Okay, on examination we can miss that findings. In most of the cases we can see a slight loss of height and increased kyphosis due to a compression of the anterior part of the vertebral bodies. Radiological features. Decreased bone mass is a more reliable condition. 30% already also bone is also before it appear on the chest X-ray. There are the 4-5 features we can discuss in the radiological features. First is the loss of vertical height of a vertebra due to a collapse. Codfish appearance, disc bulges into the adjacent vertebral bodies so that the disc become biconvex. Here you can see the loss of the vertebral height. And in the next we can see the ground glass appearance of the bone. The example like this is most common seen in a pelvis bone, and Singh's index and metacarpal index and vertebral index, or that is define the quantification of osteoporosis. These are the Singh index, and these are the only the terms you can remember that is seen in a osteoporotic condition. Now in the I can show you this thing in a picture, so you can easily remember this. Here you can first see the loss of vertical height of a vertebra due to a collapse. Here you can see clearly the codfish appearance of a vertebra. That is, the line of the caudal vertebra are bulges into the adjacent vertebra. Here you can see the mouth of the fish, and you can compare that is with. So you can easily remember this. Here the another picture of the codfish appearance. Now we can how to diagnose and investigate the patient of osteoporosis. First, biochemistry. Serum level of calcium, phosphate, alkaline phosphate, which are normal in the patient of osteoporosis. Or total plasma protein and protein albumin may be low. We can see in a cause of the osteoporosis protein deficiency, so that will lead a albumin and protein plasma low. Here the another investigation which is very important is a densitometry. This method measure the quantify the osteoporosis. Now, how in this method absorption of photon that is emitted from a gamma emitting isotopes by the bone calcium is measured. Two type of densitometry are available: ultrasound based and X-ray based. X-ray based, in which a DEXA scan are the investigation of choice for osteoporosis. DEXA full form dual energy X-ray absorptiometry. Okay. Here something is to learn about the DEXA scan, which is important. It is a gold standard in the quantification of bone mass. Here this method is invented to measure the body fat. Here the result of a DEXA scan are compared between two population. In the first, Z score and T score. Z score the same sex and the race of same age, not used for diagnostic of osteoporosis. Example, in elderly even reference will have low density. अगर हम सेम एज ग्रुप को अगर लेंगे, अगर उनकी बॉन डेंसिटी को अगर कंपेयर करेंगे तो वो तो सेम रहेगा, उनकी डेंसिटी लो रहेगी. तो हम इसलिए इस मेथड को यूज़ नहीं करते हैं डायग्नोसिस ऑफ ऑस्टियोपोरोसिस के लिए. नाउ वी कैन यूज़ द टी स्कोर, सेम एक्स एंड रेस ऑफ यंग रेफरेंस, दैट इज़ 3rd ईयर. यहाँ पे हम डिफरेंट रेफरेंस को यूज़ किया जाता है. जैसे ओल्ड एज पीपल की बोन को यंगर पीपल की बोन से कंपेयर करते हैं. तो दिस मेथड इज़ यूज फॉर डायग्नोसिस ऑफ ऑस्टियोपोरोसिस. हियर यू कैन easily remember the T score WHO classification, that is a standard deviation. We can easily classify the osteoporotic patient. 0 to -1 that is a normal, -1 to -2.5 that is a osteopenia, less than -2.5 osteoporosis, and less than -2.5 with fracture. Fracture is involved, so severe osteoporosis. You can easily remember by this graph, that is a normal, osteopenia and osteoporosis. These are the values of the given. Another two methods are neutron activation analysis. Calcium in the bone is activated by neutron bombing and its activity is measured. Another is a bone biopsy. Now we are in the part of how to treat the patient of osteoporosis. Okay, these are divided in two parts: medical treatment and orthopedic treatment. In medical treatment, we are giving the dose of the drugs and supplements, and in the orthopedic treatment, we are maintain the therapies like brace and exercise. First, we are going to discuss the medical treatment. Here we can care about the decreased bone resorption and increased bone formation on dose, and does both. In the biphosphonate drug, that is a drug of choice for osteoporosis, denosumab, SAM, or Rolexifan, HRT for postmenopausal syndrome, that are given for decreased bone resorption and increased bone formation, teriparatide, albaparatide, and romazinumab. These are given for increased bone formation and does both. Strontium ronilate, which function is a both, so it does not work, so not used in this condition, not used now. Okay. The supplements are given in the patient of osteoporosis, that is a calcium, vitamin D, vitamin K, and calcitonin. Here the doses are written: 800 to 1200 milligram per day for calcium, vitamin D 400 to 800 international unit per day, and vitamin K 200 to 400 international unit per day, and calcitonin. Okay. We can also care about the patient protein diet. High protein diet increase the formation of organic matrix of the bone, androgen anabolic effect on protein matrix of the bone, estrogen, postmenopausal osteoporosis, fluoride. Fluoride is still the condition of studies, but supposed to make the crystalline of bone greater, making bone resorption slow. Here are the important method of orthopedic treatment. There is exercise, bracing, and locking plate. Exercise, which can also help the osteoporotic patients, and in a bracing, ash brace and talar brace is used for vertebral compression stable. Of a vertebral compression unstable, vertebroplasty and kyphoplasty is done by the surgeons, and another is the locking plate is shown. In the slide I am going to showing the locking plate. Here you see the locking plates which are used in the patient of osteoporosis. Okay, so guys, here the osteoporosis, the topic for a university exam is completed. You can if you want to get my notes, then join the telegram channel, which their link is given in the description box. You can easily find out. And thank you guys for, if you like my channel, then like my video channel and subscribe my channel. Okay, thank you.